Schizophrenia by Kimberly Ward, of Ashford University for Psychology 630, Professor Sexton, on December 11th, 2018. Schizophrenia is a common name nowadays that carries quite the stigma with it, but just as with any neurological disorder, it is a spectrum and a mostly seriously misunderstood and underrepresented diagnosis. Schizophrenia usually strikes when an individual is coming into adulthood. In the prodromal stage, development of mood symptoms, cognitive symptoms, social withdrawal, and/or obsessive-compulsive behavior may occur. Within the first 10 years of one having this illness, approximately 10 to 15% take their own lives, and those with schizophrenia have a life expectancy that is 25 years shorter than their healthy counterparts. There is a minimal link that shows in regard to violence in schizophrenia when no drug abuse is present. Schizophrenia is thought to be a hereditary disease, with symptoms being classified as positive and negative. Positive symptoms are hallucinogenic symptoms found in perception and/or auditory, as well as delusions and thought disorder found in speech. Negative symptoms include the absence of some normal human qualities such as an emotional flatline, difficulty with speech and creativity, loss of motivation and/or interest. To help define schizophrenia, early science came up with the dopamine theory, which states that schizophrenia develops from a dysregulation of dopaminergic brain pathways. This results in the overactivity of dopamine function, also seen in stimulant drug use that are known to increase synaptic dopamine concentration. Dopamine is very important in maintaining normal coordination of movement, and loss of the neurons that release dopamine has been found responsible for Parkinson's disease. Blocking dopamine receptors, primarily the D2 receptor, seems to improve the symptoms of schizophrenia. However, prolonged blocking of these receptors can cause Parkinsonian symptoms. This is how the first-generation antipsychotic meds were established and were notably most effective against the positive symptoms of schizophrenia. The right dose generally was associated with some degree of motor side effects. So the continuation of research and medication eventually found some reprieve in second-generation antipsychotics, being clozapine. Unfortunately, clozapine had some serious side effects and therefore restricted use to those who had not responded well to the FGAs. This, though, led to the discovery of other SGAs, second-generation antipsychotics, such as Resperol, Zyprexa, Seroquel, Geodone, Abilify, Invega, Phenibut, Cifrus, and Latuda. The SGAs differ pharmacologically from the FGAs in that they work more on the 5-HT serotonin receptors than the D2 dopamine receptors. Negative symptoms are still prominent, even in those treated, and vary from person to person. They are associated with being single, older, and male. However, much has been done in the way of discovery of treatment for schizophrenia, and more studies are being done in order to help the treatment of the symptoms of schizophrenia. Schizophrenia by Kimberly Ward, of Ashford University for Psychology 630, Professor Sexton, on